It's Friday morning, and we're checking out the news, checking out what's going on in the news these days. We're looking at various stories after the election. We're looking at Obama flush with re-election vigor, according to CNN. Barack Obama Friday provided his first public comments on the upcoming negotiations with Congress on how to deal with pending tax hikes and spending cuts that create the so-called fiscal cliff facing the economy at the end of the year. Obama and House Speaker John Boehner are positioned as the lead negotiators in a showdown between Democrats and Republicans over the issue identified by voters as a top priority, reducing the chronic federal deficits and debt considered a threat to economic prosperity and national security. Boehner has signaled a willingness to deal, but also maintained hardline GOP opposition to any tax increase. And he's going to speak to reporters later today, apparently. His hand was weakened by the election results Tuesday that returned Obama to the White House, broadened the Democratic majority in the Senate, slightly narrowed the Democratic majority in the House. Retiring GOP Representative Steve LaTourette of Ohio told CNN that a poll commissioned by centrist Republicans showed that voters wanted Congress to fix the nation's fiscal problems rather than cling to political orthodoxy. They didn't send the same bunch back to town in this election because they love what they're doing, according to LaTourette. They sent him back because they don't trust either side, but they do expect them to get this thing done. While the result was another split Congress like the current session has become a symbol of legislative dysfunction, both sides have signaled a possible new openness to an agreement that is unreachable in the past 2 years. In the final days of the campaign, Vice President Joe Biden referred to private talks with members of Congress on the pending fiscal impacts of expiring tax cuts and mandatory budget cuts. This week, Boehner called on Obama to work with him to complete a comprehensive deficit reduction agreement, the Grand Bargain that eluded them last year. The Grand Bargain, they call it. That's kind of a scary title, the Grand Bargain. Whatever is done, you've got to wonder if they really know what they're doing with the long term in the economy. So, with this sort of, and this is being critical of my own party, but this sort of entitlement feeling with Democrats, how is this going to mix with spending and smart spending, and making sure that we're not borrowing too much and spending in a wise fashion. So, and this term, the fiscal cliff, is a little bit scary. The fiscal cliff apparently comprises two main elements. Tax cuts from the administration of George W. Bush will expire on December 31st, triggering return to Clinton-era rates for everybody. In addition, about $1.2 trillion in mandatory across-the-board budget cuts, known in legislative parlance as the sequester, will take effect next year, unless Congress finds a way to offset that amount in the federal budget. Another looming issue will be the need to again increase the nation's debt ceiling sometime in the spring. So we got to increase the ceiling, and it just seems like we're rigging the system to survive. If we're rigging the system to survive, then there's something's got to break, right? And that's the scary part. Creating the potential for more political brinksmanship, of course, with the national debt contributing to last year's first ever downgrade of the U.S. credit rating. So, and Boehner and Republicans oppose raising taxes on anybody. Instead, back a road of reform of tax system that will lower rates further for everybody while eliminating some deductions and loopholes. So it's really class warfare. The Republicans for the upper class and the rest of us with Democrats. That's the way it's sort of looking. One top Democrat with close ties to leaders on Capitol Hill in the White House said that the imminent expiration of the Bush tax cuts, means Obama does not have to do anything and everybody's taxes will go up, which is a GOP nightmare. Such an increase would affect personal income tax, the estate tax, dividends, and capital gain taxes. In addition, some officials are hinting the feared sequester cuts don't have to be implemented right away in the new year, giving at least a few months for a deal to be worked out. So, it's got to be, how hard is it to run a country, and it seems like we're always having these budget nightmares, and it seems like we should be smarter than that. I mean, a third grader could look at this and say, well, can't we balance our checkbook? What's wrong? So it is what it is, I guess. But why? How did we get in this position of overspending our checkbook? And maybe it comes down to pure greed. Maybe it just comes down to greed. Of course, Obamacare now is on the way now to full implementation. Given the stamp of constitutional approval by the Supreme Court last spring and the re-election of the President, it's clear that some form of Obamacare is here to stay, at least 4 more years. There'll be political posturing on both sides. First, the proposed expansion of Medicaid, the joint federal-state insurance programs for the poor. The ACA-driven expansion could theoretically provide Medicaid insurance for as many as 30 million poor Americans currently uninsured. Theoretically, because the Republicans in the House and Republican governors and legislatures in the states certainly could try to derail this expansion. In fact, last spring's Supreme Court decision gave states the power to reject the expansion of Medicaid in their states. However, according to this article from CNN, my guess, this is the writer talking, my guess is that they and every state will be under tremendous pressure not to reject the federal money that comes with Medicaid expansion. After all, if they don't take the money, they will still have to come up with plans to take care of the uninsured in the states and provide their own money to do so. The other part of the Affordable Care Act to follow is the implementation of the state insurance exchanges mandated by law. These exchanges are intended to provide an easier way for any individual or family to move to more closely choose a program that's right in terms of cost and coverage for them. This could especially be useful to those who are not covered through their employer and must buy insurance on their own. This idea has been at the heart of the federal employees' health benefits program for the nation's 8 or 9 million federal employees, active, retired, and their families. There was some talk by somebody I know that you could choose, the companies could choose not to cover people under their plans anymore and take the government plan and actually save money, which would put insurance companies out of business and bring a wild destabilization of the insurance industry. And the destabilization, this destabilizing effect would not be good. And I guess my most critical thoughts here is that there may be a destabilizing factor with the Democrats doing what they're doing. That's, they're going to be kumbaya and save everybody and government will save you, but if this messes up, destabilizes the private sector to a certain extent, we could be in for big trouble. So I understand that worry, that we should have respect for systems in place, however corrupt, work with the systems we have and not these vast changes or where we get ourselves into trouble, maybe. I'm still not totally sold on government health care. I don't know if that's going to destabilize the system to a certain extent where we may not be able to come back. President Obama had lost, I think both of these major programs would have been dealt a fatal blow, talking about the programs we were talking about before, but they have been given a new lease on life. As always, time will tell. And according to Timothy Johnson, the author of the article, I now believe that time will bring a positive result for many Americans struggling to find affordable insurance. So I do worry about a president that says, we're going to save you, we're going to provide care for you, the money is flowing like a spigot on the way to you. Of course they're cheering. That's why, so are the Obama cheering crowds cheering because the president is saying, you're entitled, you're entitled, you're entitled, it's going to be a great world, I don't care if you're a bum, you're going to get a great coverage now, and so that's that's a fine line to walk there, very fine line. So politics is politics, but we have to have a sensible answer for this country that's going to be a long-term answer and not just political speech making is great, but how does it really work? Well, and speaking of healthcare, now new research finds that statins, widely prescribed drugs used to help prevent death from heart disease, may lead to a lower rate of death among cancer patients too. So the statins, the cholesterol medicines, the Vytorin and the Zocor might actually apparently help cancer too. A report published in this week's edition of the New England Journal of Medicine is one of a number of recent papers suggesting that statins not only limit the growth of cancer cells but also make them more vulnerable to certain therapies. New trials have shown that medications not only effectively lower bad LDL cholesterol in those with elevated levels, but more importantly, lower the risk of having a heart attack or dying from heart disease or a stroke. So I think even exercise helps to create good cholesterol, I think is what they were saying too. Researchers in Denmark analyzed data from nearly 300,000 citizens who were diagnosed with cancer from 1995 to 2007. More than 18,000 had used statins regularly before diagnosis. More than 277,000 had never used drugs. Patients were followed for a minimum of 2 years. Among cancer patients who were older than 40, more than 18,000 had regularly used statins prior to their diagnosis. More than 277,000 never had used the drugs through more than 1 million person years of patient follow-up. More than 162,000 people died due to cancer. 14,000 died of cardiovascular causes, while 9,000 from other causes. So regular statin use before and after diagnosis of cancer could theoretically reduce cancer-related mortality. That's interesting. The results showed a reduction in cancer-related deaths of up to 5% among those who took statins. Now there could be a biasing factor in that too. People that take statins could have a biasing effect of taking care of themselves more, the conscientiousness of actually taking statins for those and those who do not. The biasing factor is that those are predisposed to taking care of themselves might be a predisposing factor to people that have better results on these tests. So just something to think about. But it is what it is, right? Researchers may have discovered a link between cholesterol and cancer. There's still more work to do on that. Much more work. Have a great weekend.